My name is Martin Sebi Raphael. I'm a refugee from Rhino camp.
Mr. Sebit Martin is a South Sudanese refugee living in Rhino Camp refugee settlement. Sebit has experienced a lot of stress in the past. He isolated himself from the rest of the community and was frequently seen talking to himself as he walked along the road. He was also constantly engaged in unhealthy arguments with his wife and children. Unlike in the past, Sebit's life has been completely changed. He now lives in harmony with his family members. He has embraced community life and works as a member of the village health team serving his local community. He counsels his friends on how to meaningfully manage stress and avoid alcohol and substance abuse. Mr. Sebit credits these improvements to the integrated program known as Self-Help Plus and Assist BI, implemented by Health Right International in Uganda, with the financial support of ELRA's Research for Health in Humanitarian Crises, R2HC. This program combines two interventions from the World Health Organization, Self-Help Plus and Assist BI, Alcohol, Smoking, and Substance Involvement Screening Test Brief Intervention. Self-Help Plus is a 5-session stress management course delivered to a large group of people using audio recordings and an illustrated self-help guidebook to help individuals manage their stress and cope with adversities. Assist BI is a brief version of the original Assist, which is delivered individually to assess the health risks associated with substance abuse, provide basic emotional support, and make timely referral to specialized care. Beyond health consequences, the harmful use of alcohol brings significant social and economic losses to individuals and society at large. To address these challenges, Health Right International integrated Self-Help Plus and Assist BI interventions and evaluated their effectiveness.
This intervention is called Assist BI. It's looking at substance use, any substance just like alcohol, tobacco, marijuana, azangi, and many others. But as per now, particularly, we shall be looking at what you use. Yes. Okay. According to your audit score, I think you're using alcohol, right?
Yeah.
Okay. Thank you so much.
Mr. Sebit and his fellow participants were assessed for alcohol and substance use, psychological distress, and level of functioning using validated screening tools. The participants were eligible for the program if they had mild to moderate scores for alcohol use and psychological distress. The integrated program started with Assist BI, which is a single, brief, one-on-one intervention based on motivational interviewing techniques. In this brief individual session, the facilitator provided the personalized feedback on the individual's substance use risk to help them understand the impact of substance use on different areas of their lives, including their health. Through this program, Mr. Sebit and other participants learned ways to reduce risks associated with alcohol and substance use. They also learned to weigh the bad and good things associated with alcohol and substance use in order to take ultimate responsibility for the choices they make, in addition to learning strategies that help them cut down or reduce intake of alcohol. After completing this one session of Assist BI, Mr. Sebit and his fellow participants were enrolled in a Self-Help Plus intervention. The intervention was delivered by a minimally trained lay provider weekly for 90 minutes over a 5-week period. From this intervention, Mr. Sebit and fellow participants acquired 5 core skills, including grounding, meaning being aware of the present moment, unhooking, that is to say, noticing difficult emotions and letting them go, acting on values, making room for difficult emotions, and being kind to oneself and others. After 5 weeks, post-assessments for psychological distress, functioning, and alcohol use were completed to determine each participant's scores before and after intervention.
Thank you, Wani. The next set of questions are about how you've been feeling during the past 30 days. About how often during the past 30 days did you feel nervous? Would you say all of the time, most of the time, some of the time, a little bit of the time, or none of the time that you feel nervous?
Some of the time.
Yeah.
The participants of SH Plus and Assist BI reported positive changes because of the program. They said they were able to focus on daily life activities, take an active part in community events, reduce or stop alcohol consumption, and engage in viable economic activities like farming.
I think my current situation is okay. I'm now staying with the people. I used to counsel even people. I do what matter in the time of stress. I like the program really very much because really it has changed my life.
One thing that I liked so much about the program is its demonstrations, its exercise. It reminds you of what you have done or what you're about to do and how you can be able to bring your attention, your present attention, and be able to focus on what you can do better.
The intervention facilitators also had positive remarks about the program as they reported that the SH Plus audio, the illustrated self-help book, and the pictorial flip book for Assist BI are easy and have been translated in a language that is understandable by the local communities. The Self-Help Plus audio course provides room for demonstrations and small group discussions, further aiding the participants' learning.
It has a picture book for participants to see whether they are learned or not. The pictures are very simple. They're able to see what is there in the picture and they understand. Self-Help Plus doesn't need specialists because in our country, Uganda, we have few mental health specialists. So a person who have completed a high school can be trained, and the training is the short training. After 5 days training, you can be as a facilitator to run a self-help session. So it's one of the easiest and simple interventions to run, which is so good, which can reach our people to the grassroots.
And then the course is audio recorded, so most of the content is in the audio. The facilitator does not need to do a lot, but rather just sit in the class and guide discussions and play a few roles here and there. So that is very impressive. It is very cost effective. 30 people going to a group at a go. That alone makes it possible for lay people to be able to deliver the course for over 30 people at a go. And also, it can handle depression, anxiety, grief, or any other stresses. So all these categories can sit in a class, which is not the case with most mental health therapies or interventions that focus on majorly maybe one kind of intervention or one mental health condition.
An integrated approach to addressing mental health problems and alcohol use appears feasible among men in refugee settings. Further research is, however, needed to examine the effectiveness of integrated interventions among men through definite randomized control trials.